case that really challenged us back home was the case of a 2-year-old boy that came with colicky abdominal pain, and he came from a very nice family with no personal relevant history towards any kind of medical problems until that point in his life. Previously, 1 month previously, he had a course of 7 days of cephalosporin third generation given by his family doctor for an acute upper respiratory tract infection. And at the point when he arrived to the emergency unit, he was really looking very, in a general, poor state, with really looking quite dehydrated for his age and height, and he was in severe pain with high leukocytosis, high CRP. Everybody at that point, because of the colicky pain, thought about an acute abdomen appendicitis. It's the first thought. And the second one, maybe even worse than that it could be peritonitis. We called the surgeon and he actually said that it was not the case for an operation. So we start to evaluate the child. And what was seen at the ultrasound was the fact that in his bowels there was a real battle given. And we put him, of course, on antibiotics, but his general state was worsening every day. And we called every day the surgeon, and the answer was no, there is actually no need for operation. And I think on the 4th day, we decided to do a CT. Of course, we have performed all the blood cultures, the stool cultures that were still pending, and on the 4th day we made a CT scan, and on the CT we saw toxic megacolon, and the 2nd day afterwards the results came from the stool culture and it was Clostridium difficile. So at that point, of course, we changed completely the therapeutic attitude, and we respected the guidelines. But it was also for us a real alarming signal regarding the fact that we should not use broad spectrum antibiotics without having the proof that they are needed, because we could link the Clostridium difficile by the usage of the broad-spectrum antibiotics. And the child was in our hospital for a total period of 10 days. He got well home, but we got our lesson also very well. So I think we should always think before prescribing broad-spectrum antibiotics that we have also other kind of antibiotics that we should use. And ESPID is a strong promoter towards real antibiotic stewardship, and is trying to implement guidelines for many diseases that affect our children.